Hirschsprung's disease is a rare gastrointestinal disorder that affects the colon and causes impaired bowel movements. We will explore its causes, diagnosis, treatment options, and long-term implications in this comprehensive video. Hirschsprung's disease is caused by a developmental issue in the colon where neural crest cells fail to properly migrate. This leads to a section of the colon without nerve or ganglion cells, resulting in obstruction and stool accumulation. Enteric neural crest cells play a vital role in colon development, innervating the gastrointestinal tract. In Hirschsprung's disease, these cells are disrupted, leading to motor function issues. Genetic mutations, signaling pathway disruptions, and environmental factors contribute to this dysfunction, and targeted therapies are needed. Hirschsprung's disease has a strong genetic component, with several genes implicated in its development. The most common causative gene is the RET proto-oncogene, RET, which is crucial for neural crest cell migration and colon development. Mutations in the RET gene can disrupt the normal development of the enteric nervous system, leading to Hirschsprung's disease. Inheritance patterns of Hirschsprung's disease vary depending on the genetic mutation involved. It can follow an autosomal dominant, autosomal recessive, or X-linked recessive pattern. Genetic testing and counseling play a significant role in identifying individuals at risk and providing appropriate management strategies. The clinical presentation of Hirschsprung's disease can mimic other pediatric gastrointestinal disorders, making its diagnosis challenging. Differential diagnosis includes conditions such as functional constipation, anorectal malformations, intestinal pseudoobstruction, and certain metabolic disorders. Certain distinguishing features can aid in the differentiation of Hirschsprung's disease from other conditions. These include early onset constipation in the neonatal period or infancy, failure to pass meconium, abdominal distension, and explosive stools upon digital rectal examination. Various diagnostic techniques, such as rectal suction biopsy and imaging studies, play a crucial role in confirming the diagnosis. In this section, we will explore how rectal suction biopsy is used to diagnose Hirschsprung's disease. We will discuss the procedure and the histopathological evaluation of biopsy samples, which helps determine the presence and extent of aganglionosis. Various imaging modalities such as contrast enema, abdominal X-rays, ultrasonography, computed tomography, CT, and magnetic resonance imaging, MRI, are valuable tools in accurately diagnosing Hirschsprung's disease. They help visualize the colon, identify abnormalities, and guide surgical planning. In the surgical management of Hirschsprung's disease, various procedures are available, such as the pull-through procedure. Different surgical approaches have advantages and disadvantages, and complications like leakage and incontinence can occur, requiring postoperative care and follow-up for optimal outcomes. Following surgical intervention, individuals with Hirschsprung's disease may require ongoing bowel management programs to ensure optimal bowel function and quality of life. Bowel management programs aim to regulate stool consistency, frequency, and volume, reduce the risk of constipation or fecal incontinence, and promote regular and independent bowel movements. These programs typically involve a combination of dietary modifications, laxatives, stool softeners, enemas, and abdominal massage techniques. The specific management plan varies depending on the individual's age, overall health, surgical outcomes, and patient and caregiver preferences. Bowel management programs play a crucial role in minimizing the impact of Hirschsprung's disease on daily activities, social interactions, and overall well-being. Stem cell therapy holds promise as a potential therapeutic intervention for Hirschsprung's disease. Various studies and experimental approaches have explored the use of stem cells, particularly those derived from the enteric neural crest or induced pluripotent stem cells, to regenerate ganglion cells and restore normal bowel function. The potential benefits of stem cell therapy include the ability to replace the missing or dysfunctional ganglion cells, promote neural network development, and improve peristalsis in the affected segment of the colon. However, significant challenges and ethical considerations surround the clinical translation of stem cell therapies for Hirschsprung's disease, necessitating further research and exploration. Hirschsprung's disease can occur as an isolated condition or be associated with other congenital anomalies or syndromes. Certain genetic disorders, such as Down syndrome, Waardenburg syndrome, and multiple endocrine neoplasia type 2, MEN2, have a higher likelihood of being associated with Hirschsprung's disease. Other associated anomalies may involve the genitourinary, cardiac, or musculoskeletal systems. The identification and management of these associated conditions are crucial for providing comprehensive care to individuals with Hirschsprung's disease and addressing potential multisystem involvement. Long-term functional outcomes and quality of life in individuals with Hirschsprung's disease depend on various factors, including the extent of aganglionosis, surgical approach, presence of associated anomalies, and overall management strategies. In general, most individuals who undergo appropriate surgical intervention can achieve satisfactory bowel function and quality of life. However, challenges such as fecal incontinence, constipation, enterocolitis, and social and psychosocial issues may persist, requiring ongoing support, multidisciplinary care, and personalized management approaches. Future directions in Hirschsprung's disease research focus on gene-based therapies, tissue engineering for enteric neural crest cell replacement, precision medicine, and biomarkers. Emerging technologies like 3D printing, organoids, and advanced imaging offer potential for personalized surgical techniques and improved outcomes. In summary, medical professionals can improve their understanding and care for individuals with Hirschsprung's disease by applying the concepts discussed in this video. Further research and collaborations will lead to better outcomes and quality of life for patients and families.